Hello, my name is Vardhanaz. For my further details, you can visit sqadia.com. So let's start our lecture today. The topic of our discussion today is skeletal system. The outlines are: what is skeletal system? Then we'll discuss the parts of skeletal system. What functions do they perform? What is a bone? So there's a question, guys. Be ready for it. The skull, the spine, ribs, hands and feet, shoulder and arm, hip joint and legs, and few facts about skeletal system. So get ready. Okay, what is skeletal system? The skeletal system is made up of bones and cartilage that forms the framework of your body. So babies have 270 to 300 bones. As they grow up, this number decreases because few bones they get fused together, and so the number goes down. So adults have 206 bones in their body. Your skeletal system is to your body what wood and bricks are to your house. So now you're getting my point. Basically, what does bones do? They have the same function like the bricks and wood they have to your home. Okay, so there's a skeleton as you're looking at it, and it's made up of bones wholly. Moving towards our next slide. So there's a question that arises in my mind: what if we have no bones in our body? So you people, even I, just look like this mass of flesh. So it's also calling itself call me blob. Okay, that's a really ugly one. So here's a cute one for you guys. Okay, it's also a blob having no bones, no shape. It can be molded in any form. If you put this in a glass, it'll form a shape of a glass, just like a jelly. Okay, so what are the parts of skeletal system? Basically, we're having two parts: the axial skeleton and the appendicular skeleton. You can say it's a division of our body into two parts. So axial skeleton has 80 bones, 80 bones, made up of skull, vertebral column, rib cage. Okay, there are three, just three. So axial skeleton, axis, it's along the axis. Just draw a straight line on the mid of your body. That forms the axial skeleton because it's around the axis. So skulls have 22 bones and 7 associated bones. The joints in the skull are called the sutures. Then we have our vertebral column. It's shown this bone is sternum. Behind this bone we have vertebral column that's really straight ahead. It's also made up of bones. Then we have total of 34 bones. 7 are cervical, that is your neck region, neck part. Then 12 thoracic, your chest part. Then 5 lumbar, 5 fused sacral, 4 or 5 coccyx. The number varies. And then we have number third, we have rib cage. Ribs. These are ribs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. There are 12 pair of ribs. So total we have 24 ribs. There's also a division of ribs as well, but I'll discuss it later in the next slides. So we are done with the axial skeleton. Okay, now we have appendicular skeleton. As the name indicates, it's appendices, appendix, your hands, your feet, your pectoral girdle, pelvic girdle. It makes your appendicular skeleton. So total we have 126 bones in appendicular skeletons. And on axial skeletons we have 80 bones. Pectoral girdle includes your shoulder, your arm or your hand. So this part of your body is making the appendicular skeleton. Then we have the pelvic girdle, which includes the hips, legs, and feet. I'm just able to show you the x-ray of your hands, so it's also included in the appendicular skeleton. So that's done. Okay. Here is diagrammatical appearance of your skeletal system. So basically this is appendicular skeleton. I've told you before, we've discussed it before. So there's just a labeling of this appendicular skeleton here. It's from the front side, and this diagram showing the back of the body. Then this is clavicle bone. This is beauty bone, you can say it. Then we have scapula, which is present on the back side. This is scapula. Here we have humerus, which is the part of an arm. Okay, upper limb. It's a part of upper limb here. This whole is humerus. Then we have radius and ulna, which is present, which forms the forearm. Okay, then we have this carpal, metacarpals, phalanges. We have the femur bone, which is leg bone. It's the longest bone. Then we have patella, which is forming the knee joint. Then we have tibia, fibula, tarsal bones, metatarsal bones, and phalanges of the foot. Phalanges of hand and feet are same. So it's the appendicular skeleton that forms the pectoral girdle and the pelvic girdle of your skeleton. Okay. Is it clear? Okay, move ahead. Okay, here we have in this diagram, I'll tell you about the axial skeleton, which is present around the axis. It also includes some of the appendicular bones as well, but you are familiar with them. So we are having, first of all, we're having the skull. That is the cranial portion of the skull, and the smiley face is the facial portion. Then we have the pectoral girdles. They are included in the appendicular skeleton. This clavicle, scapula, thoracic cage, ribs. Ribs are included in the appendicular skeleton. No, it's included in the axial skeleton. Then we have this vertebral column, which is present on the back side of the body. Here we have the sternum, and just behind the back, we have the vertebral column. 34 bones, I've told you before. Then we have this pelvic girdle, hip bones. And then we have the ulna, radius, carpals. These are the very minute details that are showing in this diagram, but I'll discuss it with detail with the bigger diagram with you guys, so don't worry. So it's metacarpals, then we have phalanges, lower limb, we have the femur, patella, tibia, fibula, tarsals, then we have metatarsals, phalanges. Here we have this is pelvic girdle. Okay, hip bones are known as pelvic girdles, and the shoulder known as pectoral girdle. So we are done with this diagram. I hope it must be clear to you guys. Okay. What are the functions of skeletal system? The skeletal system performs 6 major functions. That is, it provides support to the body. Then it helps in the movement. You move, I move, everybody move. So skeleton is performing the basic functions. There are also systems and organs and different things in our body. They're working side by side. They're also helping. But the major function is of skeletal system. Then we have protection, then blood cells production, storage, and endocrine regulation. Okay, we'll discuss one by one in detail of all the functions. So the first function is support. The skeleton provides a main framework that supports the body and maintain its shape. So basic function is to provide support and to provide specific shape. So some people are fat, some people are so skinny. Skinny people just look like the skeleton you've seen in the diagram. So the example is, without the rib cage, costal cartilages, intercostal muscles, the lungs would collapse. So the organs that are present inside our body, they're also protected by these bones. Now we have movement. The joints between bones allow movement. Some allow wide range of movement than others. That's natural. For example, ball and socket joint of hip provides wide range of movement than pivot joint at the neck. So the neck joint, it's flat. The bones are flat, so there is no uh, wide ranges of movement. Like we can do noting movements. We can perform yes or no. We can perform a little bit of extension and a lot of flexion on your neck bones. But the ball and socket joint, you can perform three-dimensional motion. You can perform flexion, extension, you can perform rotation, you can perform circumflexion, and a few other movements like lateral rotation, medial rotation, all are done. So in our body, we have two ball and socket joints, that is shoulder joint and hip joint. Okay, at various sites of bone, skeletal muscles are present which provide the movement. Muscles are present, ligaments, tendons, all these structures also help the movement to carry out smoothly. So you won't fall, you won't get any pain and stuff like that. So muscles, bones and joints. So we have three things: muscles, bones and joints. They provide the principal mechanism for movement, which are coordinated by the nervous system. Our nervous system controls these structures, and in turn these structures help us to move easily, smoothly. Okay. So this is skeleton without bones. There are joints. These bones are not, it's not one bone. There are multiple bones. They're joined together. So their joints are also present. And these skeletons are trying to move. Okay. So next function we have is protection. It protects the vital organs of our body. We have different organs in our body. The most important organ is the brain. It should be protected. So this skull, which is rotating in front of you, its function is to protect the brain. Brain is very delicate organ, by the way. If your brain gets out, you were not gonna survive. Example, like skull protects brain, I've told you before. Then we have vertebra that protects the spinal cord. Again, spinal cord indeed is a very, very important organ. Any injury to spinal cord may cause paralysis, plagia, hemiplegia, paraplegia, quadriplegia, different type of problems that are very difficult to handle then. Then rib cage, spine and sternum protects our heart and lung. Heart. So heart is like, it's like cool. So it must be protected. It has to pump the blood to your whole body. So your whole body is working on heart as well. Lungs, you can breathe with lungs. Without the lungs, you're not going to survive. So protection is the main function of skeleton, our bones that are present inside our body. So we're done with the protection. Okay. Blood cell production. As blood is running in our veins, in our arteries, heart used to pump the blood, all our cells that gets the nutrition, they get it from blood. So blood is very vital in your body. In loss of blood, if there's loss of blood, excessive loss of blood, like few people have injuries, have accidents, so excessive loss of blood may cause death. So who make our blood? Where it comes from? Bones are the sites for hematopoiesis, so that's the medical term you must have been known for it. Development of blood cells in bone marrow. Inside our bone we have a marrow, bone marrow. So it's a site for hematopoiesis, that is the formation of blood cells. In children, blood formation takes place in marrow for long bones like tibia and femur. As children are small, so they need large amount of blood, large amount of activities to do. So their blood is formed in bones like femur and tibia. And adults occur in pelvis, cranium, vertebra, sternum. So it varies in different people. We are done with the blood cell production. Okay, the fifth function is storage. How does skeletal system stores? What do it store? I'll tell you. Bone can store calcium and involves in calcium metabolism. So your mother used to give you milk every night just to make your bones strong. So what's there in milk? We have calcium. Calcium makes your bones strong, stronger and stronger. So you can run easily, you can perform your activities, your daily activities easily. It can also store iron in the form of ferritin and involves in iron metabolism. So it involves in calcium metabolism and in iron metabolism. Bone is the mixture of chondroitin sulfate and hydroxyapatite. These two things are also present in your bones. Hydroxyapatite is composed of 39.8% of calcium, 41.4% of oxygen, 18.5% of phosphorus, 0.2% of hydrogen by mass. So there's a mixture of calcium, oxygen, phosphorus, and hydrogen. It will make the hydroxyapatite. Then we have chondroitin sulfate. It's a sugar. So that's sweet. It's sugar and it's primarily made up of oxygen and carbon. So these two things uh, compose the chondroitin sulfate. So we are done with the storage of skeletal system like bones. But do our bones have? Okay, sixth function is endocrine regulation. So bone cells releases a hormone called osteocalcin. So there is a hormone that is also secreted by your bones. It contributes to the regulation of blood sugar and fat deposition. Blood sugar level is maintained by a hormone which is known as osteocalcin. Then osteocalcin increases both the insulin secretion and sensitivity, in addition to boosting the number of insulin producing cells and reducing stores of fat. Insulin producing cells are boosted, and then it also reduces the stores of fat that are present inside your body. Okay, so in this way, by the release of a hormone, how skeletal system, how your bones maintain your blood sugar level and to keep you normal, because excessive glucose is also not healthy for you people, for me, for everybody. So osteocalcin is a hormone that maintains this endocrine regulation. Okay. What is bone? Okay, I'll tell you. Bone is mineralized, dense connective tissue. That's, by the way, definition of a bone. Now, what does it consist? It consists of 30 to 40% of your body weight. That means 30 to 40% of the portion of your body is composed by your bones, and other we have different organs in our body, and then we have skin, and then we have flesh, and few people have fat as well. Okay, it's dynamic in nature. I'll tell you later the detail of this word. Then we have it provides the framework of body. Bones form the framework of the body. It gives you support. It provides the shape of your body. We've discussed it before. Now, it allows the attachment of muscles and tendons. On the bones, muscles are attached, and then then we have the tendons of that muscles. They're also attached on the bone. It permits the movement in body parts. So we can move. If we can move, we can mobilize ourselves. We can look up, down, and we can walk. So just because of this thing that they allow us to move, they have such dynamic structure. Dynamic. Now you get to know this thing. What is the meaning of dynamic? It allows us to move. We are not static. We're not robots. We can perform different functions. We can easily move. We can get up. We can even people used to dance. I used to dance, and then these movements are performed. They're helped by our bones. Okay, that's okay. Then we have reservoirs of minerals and fats. Bone stores calcium, I've told you before, so it's a reservoir of minerals, and then few fats. Fats are also deposited in it. Okay, we are done with what is bone. We have parts of bones. We have a diaphysis, that's the primary part. Then we have epiphysis, that's the secondary part. And then we have metaphysis, that is epiphyseal end of diaphysis. Diaphysis end at the epiphysis. So that point at that junction is known as metaphysis. So diaphysis is the strongest part of the bone, or and the epiphysis, it's present at the end of the bones. Then metaphysis receive maximum blood supply. So we have large number of divisions of blood supply at this point, metaphysis, so they receive maximum blood supply. Here's a diagrammatical appearance of a long bone. So this part, middle part, is diaphysis. This part that I'm circling my mouse, this pointer. Then on both the ends we have epiphysis. And so where should be metaphysis? At this junction. At this point we'll be having metaphysis. So diaphysis is the strongest part. As you can see, it's in the middle. Few other labelings are like, this is articular cartilage, which is present at the end of bones. It helps in making the joint. This is epiphyseal line we have. Inside we have a spongy bone. We have two types of bones, I'll tell you later. Then inside we have the medullary cavity. There's a nutrient foramen on every bone that receives its nutrient supply, because bones also need to flourish, and it also needs, it's present in the human body, so it wants something to eat and something to get to make, because it has to perform a lot of functions. Red blood cells are also forming inside it, so nutrition is very important for the bone as well. Then we have endosteum. Then we have the periosteum, which are present on outside. Endosteum is present inside, that's the inside layer, and then periosteum is outside layer. Again, we have articular cartilage in the end. So there's this is the anatomy of long bone. I'll tell you. Okay, now we're having the two types. There's also another classification of bone, that is compact and spongy bone. So on easy way, let me tell you, the compact bone is present outside, whereas the spongy bone is present inside of the bone, inside the medullary cavity, you can say. So this thing is trabecular or spongy bone. We can also call it trabecular bone. And here we have the articular cartilage. This blue lining is showing the articular cartilage. This is the epiphyseal plate. It's more prominent in this diagram. On the outside, just see, on the outside we have this cortical or hard bone. Then we have the medullary cavity. Then we have bone marrow. Then it's periosteum, that is the membrane which covers the bone. Below it we have endosteum. Here is endosteum, and we also have periosteum. Okay, then this is blood vessels, and here is a nutrient foramen that gives blood supply to the bone. So that's all about compact bone and spongy bone. Skull, that is rotating. Skull is composed of several separate bones that unite together at immobile joints called the sutures. So the joints at the skull, let me show you this. You're watching these lines, this different kind of lines, like somebody has thrown a hammer on its head. So these lines are basically sutures. These bones that are present in our skull, they are joined together, and there's a line that's remaining known as sutures. The connective tissue is sutural ligaments. So the connective tissues that are present on skull known as sutural ligaments. Then okay, we'll discuss about the bones of skull. So they're also divided into categories: the cranium, the head one, and then we have the facial bones. Cranium and facial bones. So the cranium Cranium, we have the frontal bone, parietal bone, occipital bone, and temporal bones. So frontal bone is this one. Then we have parietal bones, and then we have on the back of our skull we have the occipital bone, and on the above the ears we have the temporal bones. Okay. Then we also have sphenoid bones, which is one and ethmoid bone, which is present in the back of the ear. So, except for the parietal bones, all bones are 1 in number. So parietal bones are 2 plus temporal bones are also 2. So that's marked here. So you'll get the idea by looking at this diagram. Here we have the frontal bone. As the name indicates, it's present on the front side, on our forehead, frontal bone. Then we have the this parietal bone. Then we have this occipital bone. Okay. And here we have temporal bone, and it has a squamous portion. Same is present on the opposite sides of the ear. What is this? Anterior frontalis, that's the junction between the two bones. It's posterior fontanellus. Then we have mastoid fontanellus, posterior fontanellus is shown in this diagram as well. And this is the sphenoidal fontanellus. So there is a sphenoid bone which is also present. Here we have the ossification center where bone get ossified. The calcium get deposited in that bones and they get ossified. Okay. Now we'll discuss about the facial bones. I will tell you in diagram as well. We have the zygomatic bones, which are 2 in number. Where's zygomatic? Here's the portion of zygomatic bone on the side of the cheeks. Then we have maxilla. Here is maxilla on both sides. So we are having 2 maxilla. Then we have nasal bones. They're also 2 in number. Then we have the lacrimal bones. Vomer is 1 in number. Here is a vomer bone which is present inside our nose. So it's only 1 in number. So it's present at the junction. So it's only 1. Then we have the palatine bone. It's not mentioned here, but it's palate. Inside of the mouth we have a palate. So 2 bones are also present there. Inferior concha, and then we have mandible. Mandible is only 1. So this bone is mandible bones. So there are no 2 bones, only 1 bone begins from here and end here. This bone, okay, below your teeth. Facial bones are done. Up till now, we have discussed what is skeletal system, the parts of skeletal system, functions of skeletal system, what is the bone and the skull. So remaining things are the spine. Here are the vertebral column. Inside it we are having the spine. The spine is a very delicate structure, so it's protected by the bones. So these vertebrae, that dangerous looking vertebrae, are going to protect your spine. It's also known as vertebral column or backbone. Backbone, that really hurts sometimes if you fall. And it's a part of exoskeleton. Now in humans, vertebral column, there are normally 34 vertebrae. So total number is 34 vertebrae. This white bone, 1, 2, 3, 4, 5, so on. If you count them, the number goes to end at 34. The upper 24 are articulating and separated from each other by the intervertebral discs. So between the 2 vertebrae, we are having an intervertebral disc that is going to protect, that provides the cushioning effect that helps you to move a bit. The lower 10 are fused in adults, 5 in sacrum and 5 in the coccyx or tailbone. The tailbone, this one, that's end of the spine or your vertebral column, your backbone. There are 34 vertebrae in humans. The division is, we have 7 cervical from C1 to C7. Then we have 12 thoracic, T1 to T12. Then we have 5 lumbar, L1 to L5, 5 fused sacral, S1 to S5, 5 coccyx. The number varies. It may be 4 or maybe 5. So we have 5 coccyx fused tailbones. This is your spine. In this diagram it's showing. So the first 7 are cervical. Then up to this point we are having T1 to T12 thoracic vertebrae. Then we have 5 lumbar. Then we are going to have fused vertebra of sacrum and coccyx from sacrococcygeal curve. So there's a curve. Okay. So it's more prominent in this one. Here up to this we are having sacrum, and then we are having coccyx in the end. And these white lines that are showing, these are the intervertebral discs that are present between the vertebrae. Okay. This one is your cervical vertebra, which is present in your neck. So let's see what we have in our neck. Here we are having the spinous process. Every vertebra is having this process. So it's bifid. The difference is this. We have foramen here, meninges. This one is your spinal cord. So just see it. Inside we are having the gray matter, then we have white matter outside. Here are the dorsal root, ventral root of spinal nerve. Spinal nerve is passing through this foramen. So these are that labeling, so don't worry about that. This blue one is spinal nerve. As it goes inside, it is divided into 2 parts, that is dorsal root and ventral root. Then we have nucleus pulposus inside the body of vertebral body. Here's the vertebral body. This light blue one is nucleus pulposus, disc annulus. Then we have this white foramen. Small foramens are foramen transversarium 1 and 2. They're 2 in number. Then we have the anterior tubercle of transverse process, posterior tubercle of the transverse process. These two are the transverse processes. This is the anterior one and this is the posterior one. Then we have superior articular process and we have the inferior articular process. So let's come up to ribs. In humans, it is also known as thoracic cage. And this cage is going to protect our heart and lungs, the 2 vital organs of our body. It's cartilaginous and bony. So it also having cartilaginous ends. I've told you before, it encloses heart and lungs, supports pectoral girdle, forming a core portion of human skeleton. And it consists of 12 pair of ribs. Plus we have sternum, this bone. Your front bone, chest bone, has sternum. Costal cartilages we have, at these blue ones are costal cartilages, which forms the costosternal joints with the sternum. And 12 thoracic vertebrae. They're also included in this whole structure. Okay, just to clarify you guys, these red ones are, these are that are labeled, that are colored here, are the ribs. They're really fragile. If you fall, they can break. First 7 ribs, which are connected directly to the sternum. So first 7 ribs are directly connected to our sternum. So they are forming like this cage. The next 3 ribs, which are connected to the costal cartilage of the rib above, so they just get fused. Just see 1, 2, 3 in number. These 3 ribs, they are just getting merged to the above one. And last 2 ribs, this green one and then the blue one, they are floating ribs which are connected only at the back. So they're connected at the back and they comes up to the front and they're just floating. They're not connected to any organ, to any structure of the body. So hence they are known as floating ribs. Okay, there's another division we can call true ribs and false ribs. Ribs that are attached to the sternum, breastbone in front and are said to be true ribs. Those ribs that are attached to your sternum, they are said to be true ribs. And then 1 to 7 are true ribs. Later 5, they are fall ribs, in which 3 of them are fused to each other and 2 of them are floating. The last 2 are floating. Okay, hand. Now we're going to discuss the hand. Okay, a hand is a prehensile, multi-fingered organ located at the end of the forearm, forearm. So we are having, this is our forearm. At its end, this is my hand. You can also check yours if it's present. The human hand normally has 5 digits, 4 fingers plus 1 thumb. Few people have 6 as well. So that, by the way, that's exception. So don't worry about that. It has 27 bones in our hand. Total count is 27. So we're having 27 little bones in our hand, not including the sesamoid bones. No, we're not just including the sesamoid bones in it. The number of which varies between people, 14 of which are the phalanges, proximal, intermediate, and distal. So here are my phalanges. I'll tell you here. This is the proximal phalanges. This is intermediate, and the last one is, we can say, distal. So it's very far away. It's just in the end, so we can say it distal phalanges of the fingers and the thumb as well. The metacarpal bones connect the fingers and the carpal bones of the wrist. Okay, at the mid side we are having the metacarpal bones. So they are going to connect with the fingers, and then they are going to connect with the carpal bones. Each human hand has 5 metacarpals and 8 carpal bones. These numbers should be learned by you. So, okay. These are the carpals. Then we're having these metacarpals, and you know about the phalanges, these ones. This is the anterior view and this is the posterior view. There are the name designated to the carpal bones. Really important for you. First of all, we're having the scaphoid bone. Then we have lunate. Then we have triquetrum. Then we have pisiform. Above that, we are going to have hamate. Then we are going to have capitate. Then trapezoid. And finally, we have trapezium. 8 bones, 8 carpal bones are here. This one. Below it, we are having which joint? Wrist joint. So wrist joint is here. Above that, we are having the carpal bones. This is the radius, and this small little one is ulna. Okay, we are having 5 metacarpals. The number begins from the thumb. So 1, 2, 3, 4, 5. We're having 5 metacarpals. We have proximal phalanx, and we have the intermediate phalanx, and then we have the distal phalanx. By the way, our fingers also have names. This is thumb, this is index finger, this is middle finger, this is ring finger. You must have been known it. Ring finger, and then we have little finger. Same is the case on the back side of the hand. Okay, this is the anterior view and this is the posterior view. So we're going to discuss foot now. It is terminal portion of limb. It can bear weight. It allows locomotion. Without foot, it's really difficult to walk. Then what's its structure? We are having 26 bones in our foot. 26 bones are present in our foot. In which we are going to have 33 joints. That's a bit complicated, but grasp it like the way I'm telling you. More than 100 muscles, ligaments, and tendons are present. Oh God, that's too much. The joints of the foot are ankle joint, subtalar joints, interphalangeal joints, and then there are 3 joints. Our hands have phalanges, our foot also have phalanges. So these red mark is indicating phalanges are going to start. 1, it also begins with the thumb. 1, 2, 3, 4, 5. So this is all about foot. foot is divided into three parts: hind foot, midfoot, and forefoot. The hind foot is composed of talus or ankle bone and the calcaneus, that is the heel bone. Here is calcaneus. That's really big bone. So that's calcaneal, or you can say it heel bone. And talus or ankle bone we have. This is ankle joint, and on the front we have talus. This is talus, and on the back we have the calcaneus. Midfoot, five bones, that is the cuboid, navicular, and three cuneiform bones forms the arches of the foot, which serves as a shock absorber. So midfoot include five bones, that is cuboid, navicular, and three cuneiform bones, which are not here in the diagram. These three bones, they form arches of the foot: medial longitudinal arch and lateral longitudinal arches of the foot. So our foot is not flat. Basically, we form arch. So arches formed by these five bones. The midfoot is connected to the hind and forefoot by muscles and plantar fascia. Muscles also attaches the foot, gives firm attachment to the joints, to the bones. And then we also have a plantar fascia. We also have a palmar fascia. Same is a case we're having plantar fascia in our foot. Okay, now we're going to discuss about the forefoot. It is composed of 5 toes and the corresponding 5 proximal long bones forming the metatarsus. Here are the metatarsal: 1, 2, 3, 4, and 5. These long bones are metatarsal bones, and in the end we're having phalanges. Okay, the bones of toes are called phalanges. Big toe has 2 phalanges, and other 4 has 3 phalanges. So that's quite simple. Big toe is a bit small. The joints between the phalanges are called the interphalangeal joints. Those between the metatarsals and phalanges are called the metatarsophalangeal joint. That's really simple thing. The joints which are here in phalanges, they are known as interphalangeal joints, IP. The joints between metatarsals and phalanges are the metatarsophalangeal joint. Okay. Now we have shoulder and arm. The shoulder is one of the 4 major segments that constitutes the upper limb. It has shoulder, arm, forearm, and then finally we have hand. The shoulder is a complex structural unit of bone, joints, ligaments, and muscles. 3 joints formed are, the joints that are formed at the shoulder are sternoclavicular joint, sternum, the front bone, and then the clavicle, this beauty bone. It's not prominent here. Then we have the acromioclavicular joint, the acromion process of scapula. Then we have the glenohumeral joint. Glenoid cavity is basically present at the scapula. Then humeral, there's a humerus bone which is present in our arm, so it forms a joint. Okay, we are also having some rotator cuff muscles that provide stability. As I've told you before, it's a ball and socket joint, so it provides wide range of movements. You can perform 3-dimensional movement. The most important shoulder muscles, however, are the rotator cuff muscles, and these are supraspinatus, infraspinatus, subscapularis, and teres minor. These 4 muscles join and form the rotator cuff muscles. They arises from the scapula to attach to the humerus and provide support for the glenohumeral joint. Okay, here we are having this. This is a boring diagram, but you can get the idea. This is a clavicle bone. Then we have AC joint, that is the acromioclavicular joint. Acromion process. Bursa is also present for cushioning, for support, that does not cause pain. And we have rotator cuff tendons, the muscles you can say. This is supraspinatus. Behind it we have the infraspinatus. Then we have the teres minor muscle, and then we have the subscapularis muscle. Then this is the humerus bone, bicep muscles, like strong muscles. And then this is glenohumeral joint here. This dotted line is showing this is a glenohumeral joint that is forming, and this flap shaped structure of the bone is scapula. Okay, arm. Arm is considered to be the first and the longest segment of the upper limb. So upper limb has the longest segment, that is arm. It extends from the shoulder to the elbow. So our shoulder to the elbow. So it's the longest part and consists of anterior and posterior regions that are centered around the humerus. So some regions that are centered around the humerus bone. This is the only, we have only one bone in the arm, that is the humerus. This is radius. We have ulna. Here we have extensor muscles, extensor tendons originating from the lateral side, lateral epicondyle. And here is the elbow joint. Okay, forearm. It is part of upper limb and consists of two bones, that is radius and ulna. Extends from elbow joint to the wrist joint. From elbow to the wrist, we are having forearm. On the inside, we are having ulna bone, and on the outside, we are having the radius bone. Okay. Next, we have hip. Hip or coxa. Hip is also known as coxa. Is ball or socket joint. Just like elbow joint, hip joint is also a ball and socket joint. Ball is femoral head, and socket is acetabulum. It is basically an articulation of pelvis with femur, which joins axial skeleton and lower extremity. So its function is to join the femur with the join the axial skeleton with the lower extremity. Ligaments are extracapsular ligaments, and then we have the intracapsular ligaments. The extracapsular ligaments are iliofemoral, ischiofemoral, and pubofemoral ligaments, and intracapsular ligaments are ligamentum teres. So this is the diagram. This is ilium, this is iliac crest, this is hip bone. Then we have, here we have acetabulum, this is pubic bone, here we have ischium, this whole is pelvic girdle. Lower limb consists of thigh and lower leg. So basically the thigh portion contains femur and the legs have tibia and fibula bone. Thigh extends between hip joint and knee joint and consists of femur bone. Lower leg extends between knee and ankle joint and has tibia, shin bone and fibula. Tibia is also known as shin bone. Then we'll be having tarsal, metatarsals and phalanges of foot. Okay. Femur, tibia, fibula, they join at a common junction which forms the knee joint. And here we also have accessory bone, that is patella. So we have discussing about the facts. Few facts are the smallest bone in the body are found in the ear, that is stapes. This bone, it's the smallest bone which is present in our body, and the longest bone in our body is femur. This red one is femur. Okay, the bones are filled with fatty substance called bone marrow. In this marrow, red and white blood cells are manufactured and then released into the bloodstream. So we have discussed it before in functions of skeletal system, that inside the bone marrow of a bone, these blood cells are formed. Over half the body's bone are in hand and feet. This is a large number of bones in our hand and our feet as compared to the whole body. The only jointless bone in your body is the hyoid bone that is present in your throat. The hyoid bone is jointless. As your bones grow, you get taller, of course. And the last is, most people have 12 pair of ribs, but some are having 13 pair of ribs. This extra rib is called cervical rib, and it can cause neck pain. It can be surgically removed, then you will be okay. The biggest joint in the body is knee joint, which is made up of femur, tibia and fibula, the three leg bones. Bones are strong, but teeth are stronger. So get this point in your mind. The teeth are the strongest part. Bones are natural healers as it receives the blood vessels. So we have discussed our topics. That is, we have discussed the skeletal systems, then we've discussed the parts of skeletal system, functions. I've told you the 6 functions, what is bone, and about skull, spine, ribs, and then we have discussed our hands and feet, shoulder and arm, hip joint and legs. I've told you a few facts about skeletal system. Thank you so much for watching sqadia.com.